Norma Jean, you have been elected to hold the highest office that your association has to offer. In electing you to this office, the membership has placed their faith and trust in you to promote the best interests of the long-term care providers in Georgia and their patients.
Thank you ever so much for allowing me to be the head chief and the chairman of the board for this coming year. Some years ago, when I worked for Medicaid, I wore this cheese head and gave you various education sessions promoting Who Moved My Cheese by Dr. Spencer Johnson. If you've read the book, great. If you haven't, you should still read the book because it will help you to understand the opportunity to be flexible and to move with the cheese. Please know that the cheese has moved. And when that happens, you have to move through the maze, sniff here, sniff there, until you figure out where a new opening is for you to move along and do greater and certainly bigger things than you've done in the past. I said earlier that there were three things that I felt like that the chairman had the opportunity to affect. First is the vision for the business strategy of our organization, and I believe there's an opportunity for us to begin to reinvent GHCA. Reinvent GHCA. I believe that as your chairman, I have the opportunity for leadership to make sure that we stay financially viable and that we stay in compliance with all of the corporate and regulatory opportunities that are put before us. And certainly to make sure that our day-to-day operations are as good as they can possibly be so that we affect the 35,000 people that are in nursing homes, the 15,000 people that are in the SOURCE program. I don't have the number for the 51 homes that are in the assisted living, but I do know that in the state of Georgia, we have about 5,000 assisted living licensed facilities. Surely there's a lot of those that are part and connected to us that we have the opportunity to add to our organization. We are not just a nursing home association. We are a long-term care association, and we are growing, and we want to embrace assisted living, and we want to embrace SOURCE, along with those 35,000 that we know that are in the nursing home. When I say reinvent the GHCA, I wanted to take the opportunity to tell you that if you have been focusing only on a very narrow long-term care responsibility, that you must take the blinders off and open up the world and find out that it's changing. It is changing so that nursing homes are beginning to have the responsibility to become that subset of hospitals. In Georgia, hospitals are closing every year. Hospitals are closing in Georgia every year. That's not just small ones, because some of them are small, but the large hospitals are in trouble too. When that happens, the opportunity for long-term care steps up. And I want you to know that. I want you to know that the world has changed for long-term care. There are 6 mega trends in healthcare, and I want us in the Georgia Healthcare Association to think about healthcare in a much broader sense than what perhaps we have in the past. The 6 mega trends in healthcare are the end of insurance companies as we know them, the VIP care for the chronically ill. Now, in my opinion, that's SOURCE, the VIP care of the chronically ill, the VIP care for mentally ill, the emergence of digital medicine, and we're already doing a lot of that in telemedicine and various opportunities to stay connected through the electronic medical record, the end of the employee sponsored insurance, the end of health care inflation, and the transformation of our medical schools. We don't have enough physicians in Georgia. Some of us in the rural areas live in deprived physician numbers, as you know. But I want you just to think about those 6 things and think, my goodness, that's not what we normally talk about at the nursing home convention. No, it's not. We need to start talking about pay for performance, about ACOs, about CMOs, and the other whatever O's that are out there coming our way. We need to talk about readmissions. We need to talk about our infection rate. We need to talk about those things that hospitals are also talking about, because that's the patient that comes to us in long-term care. Admissions and readmissions are a hot topic, and we in the nursing home have to make sure that we don't send our patients to the hospital if we can possibly manage them in the nursing home. That's where the payers want them to stay. They don't want them going to the hospital. So I think we have opportunities to talk about the new medicine that's out there that perhaps is very different than the conversations that we normally have in long-term care. Today, I even have our medical director here from our nursing home. In the future, I hope that you are successful in getting your medical director to come. Our physicians need to hear what our challenges are. They need to know what it really means when you're telling them that you now have to collect data on this topic, that topic, the other topic. Data collection is going to come out of the wazoo, and you can poo-poo me off if you want to. And about 2018, you're going to wake up dead, because that's the way it is. We have a tendency to think that medicine has not changed. It has changed. It'll change tomorrow, and it'll change the next day. And if we don't move with the cheese, if we're not open to change, if we're not, now that doesn't mean being crazy. That means being informed. That means knowing what's coming your way, so that when it gets there, you said, I'm prepared for you, buddy. I knew you were coming. It's going to happen. It's going to happen. We're going to have to educate ourselves beyond what has happened in the long-term care industry as we know it today, because we are going to become, of sorts, a hospital, because the hospitals as we know it today are going to go away. Now, didn't cost you anything for that prediction, but I will tell you, if you want some very crazy, scary reading, read Reinventing American Healthcare by Ezekiel Emanuel, and you will see that there are folks out there that are making changes for us, that are encouraging people to act, work, and be different. And unless you are paying attention and being ready to move with the cheese, when the cheese moves, you will be left behind. With all that, I want you to know how much I appreciate your vote. I want each of you, whether you voted for me or not, to know that I do appreciate everyone in this organization. I appreciate the people that we care for even more. We must come together in one voice. We must shake it off, as the little fancy dancer says, shake it off. You got to shake it off and go forward, because it is what it is. Let's go forward. Let's have one voice. And when we send Benji and Ashton to the Capitol, we want them to hear the voice. Did you not hear Ashton, what he had to say? You go, boy. When you get to Atlanta with Benji, you say it again. He needs to be said, and said loud, and said firmly. Mr. John just said to me, it's so much better when you come with one voice and one message than it is to have conflicting voices and one side wanting green and another side wanting blue. We've got to come together. If you want a 2014 cost report, come together. If you want even more than that, come together. So that when we go together. Going in factions will get us nothing. When I worked for Medicaid, and I've told several of this, I would sit back and just smile, because I had long-term care programs, remember? And my colleagues would say, they're not going to get it this year. Pharmacy wouldn't get what they asked for. Hospitals wouldn't get what they asked for. The home health folks wouldn't, home community-based programs wouldn't get what they asked for. But to my knowledge, every year that I was there, the nursing homes prevailed. You think back now, when you want to just have a P&M session, you just think about now, which year did you not get what you wanted? It was the year that you were not together. Now, that is about as plain as I can put it. The year you didn't get what you wanted, you were not together. So let's all gather under the mother hen and let's be together with one message. And don't get your feelings hurt. Put all of your issues aside. And when we have our formulating board meeting board members that have just been installed, we're going to be better than ever. And we're going to be better than ever, and we're going to be better than ever. I thank you for your time. I look forward to serving for you and with you. And I thank you in advance for accepting any assignment that I ask you to help with.